Welcome to Frost & Sullivan's Growth Podcast. In each episode, we take a deeper look at transformative shifts shaping global ecosystems, from industry megatrends and technology innovation to evolving customer expectations. Today, we're exploring how autonomous technologies are reshaping healthcare revenue cycle management and what this shift means for providers navigating financial pressure, payer complexity, and rising denial rates. To set the stage, let's start with the basics. When we talk about revenue cycle management, what does that really encompass today?
RCM spans the entire financial journey of patient care, from registration and eligibility verification to coding, billing, claims management, denial resolution, and payment collection. What's changed is how interconnected and data-driven each of those steps has become.
Financial pressure on providers seems to be intensifying. What's driving that strain?
Denials are a major factor. More than 10% of hospital claims are denied, and payer rules around prior authorization, documentation, and reimbursement are becoming more complex. That's overwhelming traditional in-house RCM teams.
At the same time, the RCM operations landscape itself is growing quickly.
Yes, we're seeing close to 9% CAGR through 2030. That growth is pushing providers to rethink how RCM is delivered, from manual, process-heavy outsourcing toward technology-enabled, outcome-driven models.
Outcome-driven is an important distinction. What does that shift look like in practice?
Instead of paying for effort or headcount, providers are focusing on results: clean claim rates, denial prevention, faster collections, and better patient payment experiences. Technology makes that measurable and scalable.
Let's talk about what's driving this transformation. Disruptive technologies are clearly at the center.
AI, machine learning, and robotic process automation are now embedded across front-end, mid-cycle, and back-end workflows. They're reducing manual effort while improving speed, accuracy, and consistency across the revenue cycle.
Business models are evolving alongside the technology.
Exactly. Providers increasingly prefer modular, SaaS-like offerings that allow flexible adoption. In response, RCM vendors are pursuing acquisitions and AI partnerships to strengthen their platforms and stay competitive.
Another shift we hear about is RCM moving closer to the patient.
That's customer value chain compression. RCM now directly influences patient satisfaction through eligibility checks, billing accuracy, digital front doors, and payment portals. It's no longer isolated from clinical and engagement workflows.
Internal and regulatory challenges still loom large, though.
They do. Payer variability, CMS transparency rules, interoperability requirements, and state-level billing policies are forcing vendors to adopt stronger compliance and governance frameworks to reduce risk and denials.
Despite these complexities, some vendors are clearly setting the pace. Who stands out?
Frost & Sullivan's Frost Radar identified 15 leaders from over 100 it evaluated. Companies like Optum, R1 RCM, and Waystar are redefining what technology-led RCM looks like.
What differentiates these leaders from the rest?
They combine end-to-end coverage with deep AI integration. Autonomous coding, predictive denial analytics, and real-time decision support allow them to move beyond transactional services toward performance-driven outcomes.
As AI becomes more widespread, where are the biggest growth opportunities emerging?
AI-powered denial management is huge. Predicting and preventing denials before submission can recover revenue and dramatically reduce manual rework. We're also seeing consolidation and tighter integration with quality reporting and population health coding.
If you had to sum it up, what will separate RCM leaders from laggards over the next few years?
It comes down to decision intelligence, modular scalability, and partnerships. Organizations that embed AI into decision-making, scale flexibly, and collaborate across the ecosystem will lead the era of autonomous, revenue-optimized RCM.
Thanks for joining us on Frost & Sullivan's Growth Podcast. For access to our research, competitive benchmarking, and best practice frameworks, head over to frost.com or email hello@frost.com. We'll be back soon with more to help you stay clear-headed and growth-ready.